Hi everybody, and welcome to our webinar today. There's myself, Liz Andrew, and Dr. Emma Ping. We're sort of presenting a webinar today around ADHD and the impact that that might have for women during menopause and perimenopause. Um, we'll introduce ourselves to start with, and then we'll get started. We've had lots of questions come in today. And over the recent days, which have been really interesting, and we'll try and touch on as much as we can today. My name is Liz Andrew. I'm one of the menopause specialists at Menopause Care, and I am a specialist in menopause and offer appointments for various problems. But I've invited specifically Emma Ping today because she has a real specialist interest in this area. But I'll let you talk, Emma, and introduce yourself a little bit.
Yeah, I'm Dr. Emma Ping. I work in menopause care with a lot of my fabulous colleagues, including Liz. We're all specialists in menopause, perimenopause, and we've all got our specialist interests. I mean, we all see everybody really, but we've got our own little niche interests, and mine is ADHD specifically. Yeah, so most of my patients do have ADHD alongside their perhaps hormonal issues as well.
Yeah, I think we've got many women coming to our clinic who have ADHD, don't we? And we're seeing more and more women being diagnosed with ADHD in adulthood. I think we sort of agreed that we'd start by talking like initially like what is ADHD?
So it stands for attention deficit hyperactivity disorder, which in itself is a problematic title because it doesn't really describe what it is to be ADHD or to have ADHD. It's not an attention deficit at all, really. People with ADHD can have amazing attention, but it might be that it's difficult to control the attention, as in you might not be able to be attentive to something you want to or need to, but you can also hyperfocus on something else. So it's not attention deficit, and it's not even hyperactive necessarily. Historically, it's been a very much male-dominated diagnosis, and the typical person you envisage is a young boy who's hyperactive and maybe disruptive in school. But actually, for women, that can present very differently. Hyperactivity can actually be internalized, which can lead to anxiety, low mood, and affect self-esteem and self-confidence. And also the word disorder is problematic because it's a difference, not disorder. In our medical model, we put it as a disorder. And I think in a way it has to be for it to be addressed adequately and for these people to seek the help they need to navigate, let's be honest, a hugely neurotypical world. So for a medical model, it kind of has to be considered a disorder, but really in reality for people with ADHD, it's not favorable, it's not comfortable to be considered a disorder when it's a difference, not just neurological, but actually a whole body difference. We know it's not just the brain. We know there's things like hypermobility, migraines, autoimmune disease that might all play a part in a sort of whole body diagnosis. Again, it's something that we need more research in. So yeah, ADHD is what it's called, but it's kind of a problematic title.
It is a problematic title, you're right. I think many medical titles are a little bit like that then, and sometimes we need it to be taken seriously, but it can create stigma then, can't it?
There is stigma, definitely.
Yeah, I think so. And do we know much about, are there considered to be causes, or is there hereditary patterns? Is this something that runs in families, or do we know much about that side of it?
It's very hereditary, actually. 80% is the statistic. So it's about as hereditary as height.
Wow.
So it answers if you have ADHD, it's very likely you have a first-degree relative who also has it. But it also can develop because of being in the womb during development and being exposed to toxic substances.
Right.
or after delivery as a baby in infant years being exposed to very adverse environments. So it's mostly hereditary.
That fits quite a lot with when you see women and they talk about their families and siblings, doesn't it?
Yeah.
Yeah, it
Yeah.
does.
So I often say to women, do you have any family history of anything? And, often there is ADHD, but it would have been undiagnosed. But actually now that person can see that their mother or father actually did display a lot of traits.
Yeah,
Mm.
yeah. I think I quite often see women who mention that their children are being assessed or supported, and it makes them reflect on themselves and then start to wonder about themselves. Um,
The
and
average age of diagnosis for women is in their 30s. For boys, it's sort of 10, 11.
wow. And why do you think, or why do we think women are being diagnosed later?
I think they're missed as children at school
Yeah.
often because they have a higher likelihood of being the inattentive type. There's three different types. There's the hyperactive, mostly hyperactive, predominantly inattentive, and then there's the combined.
Okay.
And women are statistically more likely to have the inattentive type, which means they are not going to present as that disruptive pupil at school,
Mm,
not as likely to be picked up as problematic. And also, they've shown that girls try very hard to do the right thing and to fit in.
yeah.
So their masking ability is very high. That leads to a lot of internal struggle, but they really are able to mask and find workarounds. So as a result, and just I think just generally in the ether, still it's very much considered a male dominant
Yeah.
diagnoses. The radar just particularly with our educators, the teachers that tend to, it's not out there as a thing to be aware of. So the glasses aren't on looking for these girls. So they end up being missed. They cope just about, they bring in masking, coping mechanisms, and they kind of get by, not
Yeah.
without struggle and difficulty. And I think often that struggle and lack of support can mean that they are misdiagnosed with other
Yeah.
mental health diagnoses like anxiety or depression because a lot of internalized pressure. And it can affect their self-esteem. They never feel they reach their potential. And so by the time you get to an adult, and like you said before, you recognize your child, you've got children and they are recognized as having ADHD, get a diagnosis, and you reflect upon how you were at that age in your life, and suddenly the penny drops. You think, oh my goodness, this could be me. This really
Yeah.
resonates with me. But it's not as simple because as an adult, you've brought in all these complicating factors because of your masking, the lack of support, other diagnoses, maybe even been treated for other things. And so it's a more complicated picture. And also for women, they would have had the hormonal influence throughout their lifespan as well, which is very different to men. So again, the hormones affect the ADHD symptoms, but sometimes it's just put down to, oh, that's hormonal problems. It's just hormonal problems. What do you expect? You're a woman, you have hormonal problems, or it's this or it's that, but it's never actually pinpointed as ADHD as the underlying issue.
Yeah.
So it's just more complex.
And do you think there are any other ways that it might, like how this might impact women's lives? Are there other things that you see that you sort of really relate to the way that having adult ADHD affects women and their life?
I mean, the hormonal influence is a biggie, definitely. And we do know that hormones play an important role in how ADHD shows up in a woman. There's a
Okay.
lot of individuality,
Yeah.
one ADHD person is one ADHD person. There's a lot of, so when I talk about ADHD, and it might sound like I'm sort of doing umbrella terms, it's always in the context of that person you're talking to is very individual. And again, I should also caveat it with the fact that we do not have anywhere near enough evidence into
Yeah.
ADHD in women at all, let alone ADHD and hormonal influence. There was the first study actually looking at hormonal influence on female ADHD people was in 1990, research called
Wow.
and that was the first time they properly looked at how hormonal changes can influence ADHD symptoms. So in a woman's life, you're talking about puberty, menstrual cycles and changes within the menstrual cycle, pregnancy, post-pregnancy, perimenopause, and menopause. So it's there all the time. And some guys
Changing hormones for
ever
women.
changing,
Ever changing
and women
hormones.
can just feel completely at sea as to why. And they, unfortunately, ADHD women are one of the hardest on themselves,
Yeah,
and they will often just
definitely.
think it's their problem, that they're inadequate, because they've heard so many negative comments over their life.
Yeah.
Ends up becoming part of them, and they sort of very readily criticize themselves. It's heartbreaking, really.
Heartbreaking. And I think you really feel during the consultations quite a lot of shame and stigma and make sort of self-criticism or apologizing. I mean, I'm
Definitely.
assuming that's how you feel often, having to reassure them, no, 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 you're allowed to be you and you don't need to apologize for what you're telling me about.
One of the most important aspects of an assessment when you're seeing a woman in a consultation is the history, is hearing that woman's story. It
Yeah,
might be the first time that they have been able to be properly open and honest about their struggles and difficulties because they have felt so much shame, guilt, inadequacy, maybe even medical gaslighting in the
yeah,
past. So for me, it's really important that that patient feels comfortable, heard, validated, and
yeah,
that everything should come into the room. And I know it can feel you feel very vulnerable, but
very
I'm hoping because
vulnerable.
they know I understand it, that they feel comfortable enough to open up. Because actually, that initial discussion is the building block from which we build how we're going to and work out together as a patient doctor decision
Yeah,
how that person is going to be helped and guided. It's
yeah, absolutely.
important, isn't it? You know, we always taught
So
medical
important. I mean,
experience.
I think it's important in all consultations, but and so we see it in women every day, this relief of being able to be honest about how you've been feeling and and just telling your own honest story and is the starting process to then be able to decide, well, what can we do to support you? How might we be able to help you? But I think there are certain areas I know I see it a lot with women with PMS and the hormonal changes in that, which we know there's a little bit of those two link in with ADHD, but we see kind of being able to truly admit to how you feel and what's going on. And there's a lot of shame attached there. And I think what you're saying is that this is something we also see for women impacted by ADHD and just the beginning of sitting in a consultation with somebody who isn't going to judge you and is going to let you be your true self and talk about your experiences. I mean, we see it in perimenopause and menopause, I think, don't we, as a whole, generally.
I
Um,
think the difference with ADHD is that they've had this whole life of build up.
yeah,
Um, and although they might be coming to see me because of the perimenopause and menopause and symptoms,
yeah,
the effect of those hormonal changes and not just the actual level of hormones which change in the perimenopause and menopause, but actually there seems to be, and again there's a lack of studies, but
yeah,
anecdotally and clinically, if you actually listen to women, that there's a tendency to be sensitive to the actual change in the hormones, not just the actual level themselves.
yeah,
Which is why perimenopause can be particularly a turbulent time, because we all know that hormones can be more up and down and more roller coaster like. And that can really make ADHD women feel out of control. And their normal mechanisms, which they've used up to midlife to manage their symptoms. Sometimes they feel like they're on a knife edge, but they're managing. Suddenly
yeah,
feel they're on free fall. And they come to me, they say, I feel I'm going to lose my job. I feel I'm going to lose my relationship. It's also a time where in midlife, it's the hardest juggle, isn't it? I mean,
It's such a hard juggle, being pulled in so many different
So
directions.
many different directions.
Yeah.
And so as society, as a female, you're kind of expected to have all these balls in the air constantly,
Yeah.
delivering at a really high level on all of them, a house, being a wife or a partner, being a mother, being, everything to everybody, looking after elderly parents, trying to, hold that. And actually, that can be the hardest thing with an ADHD brain, trying to multitask, because executive function makes it hard to prioritize and time blindness can make it hard to plan your day. And so it's kind of like a perfect storm. Hormone changes, sociological changes or expectations from society.
Yeah.
And it can all sort of feel like it's reaching ahead. It can ultimately just lead to burnout, overwhelm. And but there's help. The good thing to know is there is help.
There is help, absolutely. How do you, for women who maybe have started to wonder about, because my understanding is this is something that can come to light for some women. You mentioned around 30s being a more common age for diagnosis for women. And then I know I've seen quite a few women who start to question it even during their perimenopause. It might be where they start to wonder about it. But for women who perhaps are watching, who some women will have been diagnosed with ADHD and sought some support already, and now perhaps want more support related to hormones. But for those women who've wondered about it but haven't been diagnosed or seen, how would you go about getting a diagnosis of ADHD as a woman?
I mean, I think the first thing to do is do your own research so you feel confident going into it. You can go and see your GP to ask for a referral for a diagnosis and assessment. It's typically years. That's the only problem. And actually, by the time you've got to that stage in your life and you want to actually do something about it, find out more, to wait years is painfully difficult.
Yeah.
So then the alternative is to see somebody privately. You don't necessarily have to see a doctor, interestingly. You have to have a trained professional who understands how to diagnose and assess and also exclude other psychiatric disorders or other potential causes. So I would say do your own research so you feel you really do want to go down that route of diagnosis, because the private route is quite expensive. Because once you've got your diagnosis, if you then want to have a medication titration, that's quite takes up a lot of time. And also even the medication at the moment is even difficult to get hold of. And people end up having to pay for that privately. So the outlay financially is quite large.
Yeah.
Which again is so unfair because it means it completely discounts some people just based on affordability.
Yeah, absolutely. And so for women who come what do you think are the main sorts of differences or things that particularly the perimenopause sort of impacts women who have a diagnosis of ADHD, and how do we support them with this time of hormonal change?
Yeah. So what we understand in terms of ADHD and female hormones is that there seems to be a connection between dopamine and estrogen. So we understand, from our understanding up to currently, is that dopamine, I have to always say this because
it's always current, isn't it? We're always
current because things change and we don't have as much
they do.
evidence as we would like in this area as a whole. So currently, from what we understand, is that there are several changes in ADHD bodies and brains. One of them is low dopamine, particularly in the prefrontal cortex. And low dopamine leads to some of the challenges. And from what we understand, there's a connection between estrogen and dopamine, in that if estrogen is low, in an ADHD brain which already has low dopamine, it makes dopamine availability be pulled down further.
Right, okay.
So it's reduced availability. The receptors are less receptive to the dopamine. It degrades more quickly with low estrogen. So it just means it's less available. So they've already got low dopamine, lower estrogen brings the dopamine down further, and low estrogen in itself causes and can mimic some ADHD symptoms for people who are neurotypical. So there's so many things going on. And then there's the fluctuations. It's not just, as I said before, the actual level of hormones, it's actually the changeability of the hormones, which can be very difficult for ADHD brains to cope with. So sometimes we might call that a patient who is hormone sensitive.
Yeah, yeah.
And that's something to be very mindful of when you're thinking about how to help that person, because it might mean you have to bring in certain strategies to avoid big changes of hormones, if at all possible. Yeah. So yeah, the perimenopause is a perfect storm, really, with regards to that interaction. Now, people often ask about progesterone and ADHD. Yeah. We have even less evidence about that. So there's no real evidence about certain dosages of progesterone or in terms of directly for ADHD. We know that some people are sensitive to progesterone in a bad way. Some people feel better on it. It's very individualized. And then again, testosterone is another one. We have no evidence on testosterone replacement, funnily enough. ADHD women, we know that for neurotypical women, it is licensed for low libido. But we know anecdotally for some people, not everybody, for some people, it helps with cognitive functioning, brain fog, motivation and drive, overall well-being. So that might have a part to play in ADHD, but we just don't know for sure.
No.
But I know anecdotally that certainly ADHD women can benefit from it, but not everybody. So it's something to consider. We have the most science at the moment on the estrogen.
Yeah, I think that's the same throughout with
Yeah.
perimenopause and menopause, isn't it? We've got oodles and oodles of data related to estrogen and what most women think of as HRT, and we've got a lot more limited data about testosterone, but we all are pretty sure that this hormone that women have must have some impact and change during this time, and some bits we know a bit more about, but there's a lot more work to be done. And so we quite often talk about sort of a trial of treatment, don't we, to see, well, how does this support you? Does it support you at all? And for some women, it seems to make all the difference. For others, it does very little, and some women have side effects. And I think it would be the same for women with ADHD, wouldn't it?
Yeah, absolutely.
To try it, we have to do things safely, don't we?
Yeah, 100%. And I think particularly when you're looking at HRT regimes for an ADHD person, there's some specific things to consider.
Okay.
So those include maybe some sensory sensitivities. So some ADHD people will have textural sensitivities, and that might affect how they might tolerate the different transdermal estrogens, for example.
Oh, really? That's very interesting.
So that's something just to check on. So when I look at options and go through options with the patient, I always check in. Are you going to be all right with this? And I talk about texture.
Yeah.
And some people say, oh, no, I'm fine with all texture. It doesn't bother me. Yeah. Others will say, oh, no, can't do that. I mean, in fact, that we'll discount that. We'll concentrate on this. So that's something to be aware of, because they won't necessarily tell you again.
Yeah, be honest.
They might feel a bit ashamed, a little bit. I mean, it's completely wrong. They might feel silly saying it.
Yeah.
Do not assume that they're going to be all right with that particular substance, so to speak. The other thing to bear in mind is it going to be manageable for that person, this regime?
Yeah.
So, and again, some women will find, oh yeah, I've got timers here and there, I've got calendars, they've got, they've
got lots of systems to do everything and be organized. Yeah. Okay.
But for others, it's like, oh, you mean I've got to remember this here, remember that? No, and you can see their face, you're just giving me something else to do. So in that case, we need to say, right, okay, we need to go for simplicity.
Yeah.
We need to focus that as a priority, because actually I can prescribe all sorts of things, but actually if you can't do it for whatever reason.
It's complicated to take it. It's not going to work, is it? And it's going to create more stress.
More stress, more shame, more feeling of, they're not adequate, and that's
Inadequacy because you can't even take the medicine that's supposed to help you because it's
exactly,
just the wrong regime for you.
exactly. That's really important. And then with regards to things like dosage and introducing HRT, we look back at how they have responded to hormones in the past, maybe, and their natural hormonal journey. And that might give me some sort of indication of how we introduce the hormones dosage wise, route wise, and whether that person needs something a bit more bespoke to make it okay for them.
Yeah,
Yeah. And I always say, look, we'll start here, but we might need to tweak it. It might not be right, for whatever reason.
yeah,
And then when they come back, we just think, okay, what's working for you and what's not. And again, I really hope they can be open with me and just say, and not feel worried that they're saying they can't do something's not working. Because unfortunately, they actually have a tendency to be real people pleasers as well.
yeah. I think women are even more so for
Yeah.
that than anyone, aren't they? And you do sometimes think when I ask you, please just tell me what's really going on. You don't have to give me there's no right answer
No,
to
no.
this. If you tell me what's really going on, we
Yeah.
can adjust it to that. There's not right answers, but I think lots of women, particularly in medical consultations, have a real desire to almost give an answer to please their doctor, don't they? Yeah,
Yeah, absolutely. And I
yeah,
think that can be even more heightened for my ADHD ladies. So I really hope they feel just comfortable and relaxed, and whatever they come with, it's my job to work with that. It's not their job to do the right thing.
yeah,
It's my job to
absolutely.
get it right for them, to make it work for them together. And the only way we can actually do that is openness and honesty on both sides, in terms of what we can achieve and what's doable and what's tolerable for them. And then hopefully with that formulation, we can ultimately get to some hormonal optimization for them, which, as we know, will not only help them hopefully function, feel better, and maybe get them back to the point where they were managing before their hormones started to go awry.
Yeah,
But
yeah,
also we know about the long-term health benefits of HRT potentially. And unfortunately, statistically, ADHD women have a higher risk of diseases and comorbidity. So the more we can bring in to help prevent that,
yeah.
for this particular,
Better.
it's potentially a very vulnerable group. So yeah, that's why that's a little bit of a snippet of a little bit of how I particularly discuss regimes and going forward with HRT, particularly with ADHD patients. Obviously, there's a lot of individuality within it.
There is, yeah. And have you, I noticed somebody's asked a question in the chat, but also I'd been thinking about it. Have you, I'm sure women discuss with you in appointments to do with impact on work, particularly at this time of life, because we hear that anyway, that how perimenopause can really affect women related to work environments. But I'm sure that relating to a sort of ADHD brain, it can make a big difference. Have you heard any ideas, or do you have any thoughts about things that can particularly help in a work environment related to adjustments at this time, or things that women might find helpful for how they sort of support functioning during this time of perhaps we're trying to adjust HRT with them and they're having a tricky time anyway?
I mean, I guess the answer to this really is the answer to functioning in every part of your life,
Yeah,
really.
yeah,
In terms of work, you could, if you have a diagnosis, you can ask for reasonable adjustments. Some work environments will offer a coach.
Oh, really?
Um,
Okay.
but you do need an ADHD coach, because a generalized coach will probably not understand how to, yeah, to
Mm.
pitch it really. But I have got patients who have been offered that, which is fantastic.
Oh, really? That's
Yeah.
amazing. Okay.
Access
Freedom
to,
employer.
access to work and reasonable adjustments. And that's going to be quite individualized, but sometimes having some flexibility when you work, ensuring that your working hours are when you're functioning at your best, particularly if you're on medication. If your medication efficiency window is between this time and that time, that's when you want to aim for your productivity, and maybe when the medication is wearing off in the evening, your boss needs to not expect you to be working then. That's your reset recovery time, probably when you need to eat and you need to get your rest and you need to get your sleep. So, it's quite a nuanced.
You need to know yourself really quite well to be able to ask, because the workplace probably aren't going to come up with the adjustments for you. You've got to know yourself quite well to then be able to be open and honest about, and that, I mean, that's where a coach comes in with some experience, if you can access that, but thinking about what you might need to be able to then go and ask whether these things are possible, I imagine it's a tricky journey, that, isn't it?
And
Working
it
it out
depends
for yourself
what
first.
what you're struggling with. Somebody might say, I just can't sit in a meeting for an hour and a half still, on Zoom.
Yeah,
And maybe they'll say, okay, let's have you on the audio, but walking around, you know.
yeah,
Or
okay.
maybe, I just cannot bear this nylon top. It makes me itchy and uncomfortable, and I'm thinking about it all day. It's distracting. I need a different uniform.
I need a different uniform. Yeah,
Yes, as simple as that. And you should never feel that you can't ask for something, because at the end of the day, you're doing them a favor because you're increasing your productivity. It might not fit with a neurotypical what they would require, but hopefully there is more chat and there's more openness. It's not as much as we'd like in terms of neurodiversity. So hopefully it would be completely alien to somebody to be aware that that person might need something different. But disclosing the diagnosis to your boss sometimes can be, a difficult decision,
yeah, yeah.
depending on your relationship with your boss and who your boss is, because there is still stigma and judgment, unfortunately.
And
So
there are a lot, like perimenopause and menopause, there are lots of myths, aren't there, attached to what it means and what it looks like and how that means you behave, or yeah, it makes it so
with
difficult.
your original question about work is, like you said rightly, Liz, get education. So look at resources, trusted resources, get to know yourself the best you can. And that's a really big place to start. And, whether you go down the diagnosis route and decide to have medication, because actually, hormonal support can make a huge difference for women.
Yeah.
But also for some people, ADHD medication can make a huge difference as well.
I know we within clinic don't prescribe specifically medication for ADHD. We manage the hormonal side of things, but what are the typical sorts of groups of medications or typical medications that women might be offered who are newly being diagnosed with ADHD, or might want to explore medication in that field? Is that something you can talk about?
So typically, women are offered a stimulant type of medication. There's also non-stimulants, which might be appropriate for certain people with certain histories.
Yeah.
Stimulants are 80% effective. Once you've got the right dose,
Oh, wow.
right regime, minimize side effects, 80% effectiveness, which is virtually unheard of in the
That's
medication.
brilliant. You don't get that in most medications, do you?
Don't know
Wow.
anything that's got quite such a high statistic.
No.
It doesn't mean it's necessarily going to be a magic wand overnight. And for some women, they'll get to a point with a dosage and then they start getting side effects and need to stop there. But the regimes can be very bespoke. Sometimes it's a combination between a stimulant and a non-stimulant, depending on their symptom set. And some women need that hormonal support behind that to help get the most from the medication at the minimum dose. Because we do know that women will report in the perimenopause or premenstrually that their medication, which previously was working well, suddenly stops working, sometimes completely.
Yeah.
And this hasn't been very well recognised, and still some psychiatrists won't recognise it, but some women benefit from the hormonal support, or some will have an alteration in the stimulant medication in that vulnerable time in their cycle.
Oh, right. Okay. Okay.
So there's a few ways that things can be tackled, and that's really, again, a joint doctor-patient decision, because some women will say actually either they didn't tolerate the ADHD medication and would prefer to go down more the hormonal route. Some are able to bring the two together. For some women, it's a financial constraint of being able to access ADHD medication
Yeah.
reliably. And to say there are side effects with it. It can affect appetite, sleep. Some people, it affects their mood. It can make them feel on edge and jittery. Sometimes these side effects are transient. Sometimes for some people, it's just intolerable and they have to reduce the dose or stop it completely. So it needs to be very carefully and safely monitored by your prescriber. But we can do it alongside the hormonal support. And for some women, they'll come and see me first, which I think is quite a nice way round to do it, because actually, if we can optimize their hormones, they're more likely to get the most out of their ADHD medication. And it's kind of often a simpler and cheaper way, really.
That's been my general feeling. I
Yeah.
get the feeling, let's try and support the thing that we know is suddenly changing at this point
Yeah.
and see how you get on. If you're saying you've always maybe known about this but coped quite well and things had been going okay, and maybe if we could stabilize the hormonal change a little bit and then make a decision about whether you need to go and re-explore that again or explore it for the first time.
And bringing in other things. There's so many other things you can bring in to help ADHD, like CBT or DBT, and lifestyle, exercise, mindfulness, meditation, some dietary tweaks that can be made. And so there's a whole umbrella of strategies we can bring in. I think once the penny is dropped and you recognize it in yourself, whether you're diagnosed or undiagnosed, it doesn't actually matter to me. If you feel you've got ADHD or ADHD traits, we'll work with that.
Yeah.
And we can tackle that from many angles. There's never only one. And I think there was a question, what do I do if I can't have HRT? And there's so many other strategies that we can bring in to play to help that person. Sleep is so important in menopause and in ADHD in terms of brain functioning and mood regulation. So yeah, there's always something that can be brought in to help.
Yeah,
there's always hope.
Huge yeah, there is always hope. There is always hope. And I think that's one of this comes up in all the webinars I do, actually. Practically every doctor mentions at some point near the end, there is always hope. There are so many, we've got this huge jigsaw of well-being, haven't we? And within ADHD, it's the same, where there are little parts that can be adjusted, and making a few small adjustment in a few areas can really make all the difference, can't it? And hormones and taking hormone replacement or adjusting hormones can absolutely be part of it for lots of women. But for those women who choose not to or can't for various reasons, there are often other things that can be, if you really kind of investigate and listen to what's going on in a woman's life, that can be tweaked, and with a bit of support and different types of support, exactly like you've mentioned. Yeah. Absolutely. Do you think there's anything else that we haven't sort of touched on that would be really important to women with ADHD?
And I always want to put this on the prescription at the end of nearly every consultation, is self-compassion. It's self-compassion.
Yeah, self-compassion, absolutely.
As I say as I said at the beginning, ADHD women are so tough on themselves, so self-critical.
Yeah.
And, they try so hard, often perfectionists, which is because sometimes it's a result of compensation, for the environment they find themselves in. But I'd say self-compassion, that's really hard. It's really hard because it's obviously not part of their natural makeup, but they need to be kinder to themselves. I know it sounds a bit woolly, but honestly, it really is worth dusting a big amount of that on each ADHD person you see, because every bit will be a step in the right direction, away from all the negativity and self-criticism they've had up to that point. So self-compassion and self-kindness is a big one.
Yeah, it's a really lovely thought. And I think just to be able to have a consultation and know that you'll be heard however you come and however you show up. And I know we have women that come to us who sometimes find consulting in person tricky, or consulting on video tricky, or the amount of people that apologize for the environment they're sat in, like they might be at home in their bedroom or they're at work and it's a busy environment, or and the apologies that really aren't required, are they? It's
No,
like
at
we
all.
see people in all settings. I've had women who would choose to, perhaps for the beginning of the first consultation, even their cameras off, and I say that's fine, I leave mine on and you do what's right for you in this appointment. And normally, once the trust's gradually been built, you find the camera suddenly comes on, and they want to be more with you in it. But there's a lot of negative self-chatter, isn't there, in the
Definitely
brain? And I think from what you've been saying, within an ADHD brain, that negative self-chatter's
more
possibly
intense.
very loud
Yeah,
and
definitely.
intense.
Yeah,
Yeah, yeah.
absolutely. Yeah, and
And
I think because I do online consultations, but I think that lends itself to my patient group particularly well. It cuts
yeah,
out a few more executive function steps that they have to bring in to actually come and see me. So it
yeah,
doesn't matter if their time blindness means, you know, they've forgotten and they're just, in the car, in the airport, in
yeah,
the station,
yeah.
on the train. Really doesn't matter.
No,
It's perfectly fine. We'll work with whatever environment is. The point that you've made the appointment, you've recognized what you need, that you need help, and you're here. And that's massive.
yeah.
And yeah, there's no judgment with regards to how they show up, like you say, and we can adjust the consultation depending on that person.
And the point's to try and fit in with what works and what's going to support them, not us.
Yeah,
We're there to be the support and the
yeah, yeah,
advocacy, and work out how we're going to be able to support them.
yeah,
Yeah,
absolutely.
that self-compassion, I really like that, Emma. I really like that.
Like you
Uh,
say, all women could benefit from that, actually.
yeah, I think all women could benefit from it. I absolutely agree. I mean, there's so many things we've touched on that relate in many ways to lots of women's midlife experience, aren't there? But I think it's just talking about it for different settings can be incredibly important. Um, I think that's probably quite a good place to. There's so many things we could cover, aren't there? There's so many things we could cover. And there's lots of really excellent individual sort of questions. And we're going to keep doing webinars as part of Menopause Care on hopefully a monthly basis, which obviously some of you have managed to log in and watch today, but we'll also be uploading to YouTube and sending out some links. So for anybody that would like to share the webinars, they think they might know somebody or a family member or a friend that might benefit from it, then feel free to please share the links. And we Emma offers appointments at Menopause Care, not just for women who have ADHD, but covers all parts of menopause and perimenopause. And we also have another doctor, Dr. Emily Kelly, who also has an interest in ADHD alongside perimenopause and menopause. But all of the specialists at Menopause Care sort of conduct our consultations in a very similar manner and are open, and it's about listening to women and hearing women. And all of us are very used to seeing women who perhaps think they might be affected by ADHD, or perhaps have a diagnosis of it. But Emily and Emma are particularly good where things have perhaps become a little bit more complex for them, or they feel that side of their picture is maybe their ADHD is more tricky for them, and it's more that wants looking at alongside the hormones. But we're all very open and looking to be compassionate to everybody, aren't we? Yeah. Um, any feedback from these webinars is very gratefully appreciated, and I think there will be some follow-up emails that come out explaining what we can offer from the point of view of appointments, but also just gaining feedback. And if anybody's got ideas about other topics that you would like as to invite speakers or learn more about, then I'm open to lots of ideas. So that would be gratefully received as well. But I'm really grateful for you coming and chatting and sharing all of your expertise today, Emma. It's been wonderful.
Enjoyed it.
Really interesting, really interesting. And we'll say bye.
Bye for now, Liz. See you
All
later.
right. Bye. Bye, Emma. Bye-bye.